Good morning, everybody. Today, our topic is about lifestyle, so it is very different. And I am appreciating and I would like to thank MIMA for concentrating on lifestyle. So, the conference this year was focusing on the impact of lifestyle on health. And my role was to moderate nephrology session. So I started with introduction, then I delivered concluding remarks. So let me just to show you summary of my presentation that was delivered on Friday, April 20th, within the MIMA activities. Before I'm going to present, I would like to thank my great friend and brother, Dr. Tariq Tantawi, for his best and sincere coordination, and all the MIMA board for concentrating on this very valuable to change the human behavior in lifestyle and the changing the way of life. This is a very fantastic view. To start with, International Society of Nephrology last year announced and published the Global Kidney Health Atlas, which is very fantastic, including a lot of informations regarding risk factors of kidney diseases. One of them is obesity. You can look here to the color code and the world map. Egypt here, the color of here is 20 to 30% of Egyptian persons are obese, and those who are aged above 18 years are obese. Regarding smoking, persons above age of 15, this is the color code. If we concentrate on Egypt, this means that 20 to 30% of persons aged above 15 in Egypt are smokers. Hypertension. Here, hypertension in Egypt is between 25 to 30% among adults above 18 years. Diabetes. Nowadays, diabetes is increasing. So the prevalence in adult Egyptians are exceeding 16%. And if we look at these issues, I think if we increase the public awareness and working on the lifestyle change, this will make a big difference. I attended the 22nd Pan-Arab Conference on Diabetes that was held on last March, and I enjoyed very much the debate delivered by University of London by two elegant professors. One of them, Professor Jaco, defended the prevention of diabetes, and his topic was prevention is the best way to limit the epidemic of diabetes, followed by Professor George, whose topic was reversal is the best way. So the Professor Jaco addresses the issue of addressing the different risk factors from lifestyle modification, and diabetes is reduced significantly by interventions toward risk factors. And this is the components of metabolic syndrome, that the components of metabolic syndrome are significantly reduced with the intervention group. To the other side, Professor George showed that working on a population is accompanied by many barriers, and these barriers, we should go all through these barriers to be effective. Business, fixed science, etc. And his opinion is we should diagnose diabetes early, and working on an individual early by aggressive risk factor modifications. This make diabetes reversed. And one of important strategy is to tell the patients about story of other patients. So anecdotal reports and sitting together with other individuals who succeeded for diabetes reversibility can make an effect. If we look at these two concepts, prevention and reversion, Is diabetes preventable? Can diabetes be reversed? These are two important concepts that we should work upon, because in the past we consider diabetes as permanent and we just care and not cure. Nowadays this is a trend toward diabetes cure. Another important point in hypertension, non-pharmacological interventions through addressing lifestyle and lifestyle modifications carry best level of evidence. So all lifestyle changes, beneficial effects, carry recommendation based on best evidence of research. So all of them are 1A: weight loss, healthy diet, and sodium reduction, potassium supplementation, increased physical activity. All these issues carry recommendation based on evidence. And one important issue to concentrate on the lifestyle modification is through World Kidney Day activities. So this is one of the brochures or banner of the World Kidney Day activity. Here Professor Nagy and his team, and here we should combat the bad lifestyles, obesity, smoking, and other issues, and taking medicine. And last year, on March 2017, World Kidney Day was focusing on exercise. This year, it was toward women's health. But the behavioral change is not so easy. It is a very difficult task. And these are the theories for behavioral changes. And I'm not going to discuss all of them, but here health action process approach, including motivation, so we should motivate persons, and volition. Volition, we should help them to have a willing attitude toward changing their lifestyle. So we should have a person who have the willing to change, and we should motivate them. Why he should have volition and willing to do so? Because you cannot cross the sea merely by standing and staring at the water. If we wanted to cross the sea, we should go directly to water to swim and to cross the sea. Trans-theoretical model for lifestyle change. This is an old hypothesis by Broshazaka and others. Here, the human behavior is controlled through 5 steps. So we have 5 steps. Starting with pre-contemplation. This means that the person is eating, smoking, and he doesn't concentrate in anything. He is happy by that. So he doesn't think of the problem. So this is pre-contemplation. And then contemplation, he is thinking this is a bad habit. So he's now considering the bad lifestyle. And then preparing himself by putting a plan to change his behavior, but still this is on the level of plan. And then action, start the journey for changing the behavior. And the 5th step is to maintain the new lifestyle. And the most important the difficulty and the problem in this trans-theoretical model is relapse. So we should put all these points in our mind. During this session, Professor Kamal Okasha delivered a very interesting presentation about stresses of life and the kidney diseases. And I added that we should learn and we should teach the people about the healthy sleep. So, because sleep disturbances are associated with chronic kidney disease, either through obstructive sleep apnea or without obstructive sleep apnea. Why? Because sleep disturbance is associated with increased sympathetic activity and other pathways. And this is a relatively recent study showed that if sleep duration is less than 6 hours, 6.5 hours, or sleep fragmentation is there, the prevalence of CKD progression is increasing. So the end-stage renal disease event rate per 100 persons per year increased significantly if sleep duration is not sufficient or sleep fragmentation is high. Moreover, mortality is increased by poor sleep. So from this point of time, we should encourage healthy sleep by taking care of the proper way to have a sufficient sleep in a relaxing manner. Smoking is harmful to the kidney and affects all the components of kidney, including glomeruli, tubules, interstitial structure, and the blood vessels, as demonstrated by my colleague and my friend Dr. Mohammed Kamal Nassar through his very nice and comprehensive presentation. Even more, Dr. Mohammed Kamal mentioned that smoking affects kidney transplant badly, and we should be sure that donor and recipients are not smoker, because smoking affects graft survival. And I added on my comment, we should consider the smoking as bad drug, because even it may interfere with other drugs. And I give an example, cyclophosphamide. If the patient receives oral cyclophosphamide and he is smoker, smoking enhances the metabolism of cyclophosphamide, and by enhancing its metabolism, the metabolism of cyclophosphamide, metabolites will reach urinary bladder, and this may increase the risk of hemorrhagic cystitis. So smoking is bad, and it affects all body systems, including kidney. And so in nephrology service, in outpatient clinic of nephrology, we should learn and we should teach the patients that smoking is bad, and just by saying a very simple statement that smoking is a kidney poison. Then physical activity and kidney. This is a very nice topic addressed well by Dr. Waleed Refaie, and I added that we need physical exercise to retard the progression of chronic kidney disease, for decreasing stones. And when we tailor exercise, we should look at the individual. So exercise is advised according to the capacity of the patients, and gradually we can increase according to the patient ability. And here, this is a nice review about physical inactivity as a risk factor for the patients. So in CKD, dialysis, and after transplantation, inactivity, physical inactivity, can lead to even mortality and muscle wasting, as you see. So we should encourage physical activity. And I remembered Professor Hassan Abu Aisha in Sudan when we visited Al Khartoum in 2014 in collaboration with Sudanese Nephrology Society and Egyptian Society of Nephrology. And Professor Abu Aisha delivered a very nice presentation about exercise. And during the presentation, he asked the attendee just to have 1 minute for exercise, and you can see the happiness of all attendee, and all of us shared him in this issue. Nutrition and kidney. This topic was presented by Dr. Kareem Nagaty, and he presented it in a comprehensive way. And I added that although in this very recent article showed that metabolic syndrome, but not obesity measures, are risk factors for accelerated age-related glomerular filtration rate decline in the general population on a study including 1,261. But my critical appraisal to this concept, we should target obesity. Why? Because it is the avenue for metabolic syndrome, and it predisposes to metabolic syndrome, diabetes, and hypertension. So we should put it in our mind. And metabolic syndrome is associated with many mechanisms. It is associated with oxidative stress, profibrotic, and gut dysbiosis and disturbing gut microbiome. All these mechanisms can lead to chronic kidney disease. Again, salt. This is a study showed that very low salt, the first quartile, sodium chloride less than 2 gram, and here above 4 gram, it is bad. So we should, this is the salt intake, sodium intake. So the advice is the physiological need is less than 5 grams sodium per day for persons. So we shouldn't exceed 5 gram sodium chloride per day because it is harmful, associated with hypertension, chronic kidney disease. And the very low sodium or diet free of sodium also may be harmful. So the advice is just to have for the adults 5 grams sodium chloride per day. Regarding the new concept in salt-sensitive hypertension, in the past we considered salt-sensitive hypertension is a person who cannot get rid of salt load. But the hypothesis within this article was challenged. Here, both salt-sensitive and salt-resistant persons can get rid of sodium efficiently. So it is not a problem of sodium retention. But what is the problem? The problem is for a person who has salt-sensitive hypertension, there is a problem in renal vascular resistance. So salt-sensitive hypertension, salts can increase the vascular resistance of the kidney. So this is why in salt-sensitive hypertension, they can respond to salt. Moreover, we can think of the targeting the vascular resistance because increasing vascular resistance will be associated with increased main arterial pressure. Diabetic persons are more prone to the problems of salt, as shown in this very recent article. This is salt MRI. Here you can look at the muscle of the control, and this is the muscle of the diabetic person. Here salt is deposited within the muscle and also within the skin of diabetic, so we should be careful about salt intake in the diabetic person. Regarding red meat, yes, red meat included essential amino acids, but to the other side, red meat has excess sodium, excess phosphate, increases oxidative stress. So as you see, the balance is tipped toward harmful effect. So we advise against red meat. And I think the Mediterranean diet is more renal friendly. And this is the same approach to stop hypertension and for a reduction of stone. So we encourage, if we start earlier in the early CKD, we advise for fruits and vegetables because in advanced stages we may be afraid of hyperkalemia. Why we advise fruits and vegetables and to reduce salt and red meat in the early CKD? Because fruits and vegetables are associated with supporting and giving the person base, so they reduce the acid production, and the heavy protein increase acid load. So by reducing acid load by encouraging fruits and vegetables, this may be beneficial to guard against the progression of chronic kidney disease. But as I mentioned, we should start early before before the risk of hyperkalemia that increases with advanced CKD. Regarding diet soda, you can find a person eating a heavy meal and then asking for diet soda. In this study, diet soda consumption was associated with increased risk of incident in end-stage kidney disease. This means that diet soda is harmful to kidney. Why? The question is why? Because diet soda contains a lot of phosphate, a lot of phosphorus. increases acid load, and may disturb gut microbiome, so it can lead to dysbiosis. And I added some points in this presentation. This is a case, and from this case, I would like to deliver a message regarding drugs. We should avoid drug abuse in general. So this is a 42-year-old man presented with altered mental status and severe respiratory distress at the emergency department. He was immediately intubated. On his admission, his family indicated that he had been sleepy and restless and had experienced difficulty standing and walking over the preceding 2 weeks. He developed flu-like symptoms 2 days before admission. His medical history revealed that he was taking ibuprofen 800 milligram 4 tablets per day for headache, and he had increased the dose to 6 tablets per day because of his flu symptoms. Physical examination revealed diminished generalized osteotendinous reflexes, normal cranial nerve examination, and the Glasgow Coma Scale score of 7. Laboratory tests showed the following: serum pH 7.06, severe acidosis, bicarbonate 11.3 millimole per liter acidosis. Serum potassium is very, very low because in acidosis we are expecting high potassium. So if we find potassium of 0.9 in the presence of metabolic acidosis, means extreme wastage of potassium. And then serum urea, serum creatinine is 2.7, acute kidney injury. Urinal pH is 6 in the presence of severe acidosis, means alkaline urine. And urine potassium and urine ion gap is 16. This means it's positive. So this is renal tuberous acidosis, severe hypokalemia in a patient who consumed big dose of ibuprofen. So the case is ibuprofen induced severe hypokalemia and renal tuberous acidosis. The message is we should be cautious when we use even over-counter medication, and we should restrict the dose because big doses may be associated with emergencies. The second point is nephrotoxicity of herbal remedies. I'm totally against herbal remedies, and this table summarizes different Chinese herbal remedies by their name, Latin name, English name, and Chinese name. And this figure summarizes why herbal remedies may be associated with kidney injury. This is because of herb-related factors, including intrinsic toxicity of herbs, incorrect identification, incorrect processing, incorrect storage, adulteration by adding certain materials on the herbal remedies like non-steroidal, diuretics, or laxative to alleviate the patient's symptoms. But on the long run, all these added parameters can lead to problems and bad consequences, or contamination by heavy metals. So all these are herbal related factors. Treatment factors offer dosage, longer than required duration of use, interactions between traditional Chinese medicine and drugs, patient factors, clinical condition like chronic kidney disease, allergy, or different gender and age. So these are the 3 factors that can lead to kidney injury for persons receiving herbal remedies. At the end of the presentation, I used the quotation of Donald Rumsfeld, who stated that there are known knowns and unknown unknowns. And in medicine in general, we have a lot of unknowns. So we have many gaps in medicine. And our job is to try to fill the gap by good training, good education, and doing research. And this is a very nice template that I'd like, and I'm very proud to have it, Egyptian Society of Nephrology and Transplantation Virtual Academy, because It is very wealthy, including more than 3,100 lectures, more than 3,300 videos. You can go all through them, and you'll find even the presentation of the current MIMA. If you click on this link, you'll find all presentation, including the lifestyle and the kidney session. At the end, we should learn. Even for our teach, we learn through teaching. And in a simple word, I am living because I am learning. And the most important aim and the great aim of education is not knowledge in itself, but action. But it's to transfer it into action. And one of the most important challenges is to change the human behavior, changes bad lifestyle into well and beneficial lifestyles, and this will make great difference, prevent diseases, and prevents consumption of drugs. Thank you very much for your attention, and I'll be happy if you have any questions to send to my email. Goodbye.